Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to dental cements. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now in today video we will study the definition and uses of dental cement. But it is a initial video of dental cement series. In next video we will be study classification of dental cement, and then we will study each cement in detail, its definition, indication, contraindication, advantages, disadvantages, its properties. Mean this dental cement series will be consist of 8 to 10 videos. Now today is the first video of dental cement series. Now first we start from definition. In definition we will study what is cement and what is dental cement. Now what is cement? Cement is a substance used to glue two solid bodies. Mean like we use a cement in a building construction. We use a cement to meet the two brick with each other. Same here in dentistry we also use cement, but here cement have many different application. Now, cement is a substance used to glue two solid bodies, but cement used in dentistry have many different application. Application mean uses. Mean cement have different application, different uses in cement. Now come to the uses. Uses of dental cement. There are 6 major uses of dental cement. The first use of dental cement is cementation of indirect restoration. Now, what is restoration? Then what is indirect restoration? Then what is cementing? First, restoration. When our tooth structure loss, we try to restore the lost tooth structure by filling the tooth, by construct the crown cover which cover the tooth. We restore the tooth by bridge. This is the restoration. Restoration mean to restore the lost natural structure of tooth by filling material, by crown, by bridge, by any other source to restore the tooth function, aesthetics. This is restoration. Now come to indirect restoration. There are 2 types of restoration. One is direct, one is indirect restoration. What is direct restoration? In ward, when patient come in ward, we directly fill the we construct the cavity, and we directly fill the cavity up to by composite, by amalgam, by GIC. This is known as direct restoration, when we directly fill the cavity in the ward, in chair side. But what is indirect restoration? In indirect restoration, we prepare the tooth in chair side, in the ward, and we take impression of this prepared tooth and send this impression to the lab. In the lab clinician make the crown from this impression. When we send the impression, this make the crown and send the crown to us, and we cement this crown on the prepared tooth. A patient in the word. Now, why it is called indirect restoration? Because the construction of restoration not directly on the patient, the construction of restoration crown any bridge, the construction of crown bridge on lay inlay occur in the lab. Therefore, it is known as indirect restoration. Now, then we cement this crown and the prepared tooth with the help of dental cement. Now, here the dental cement act as a glue, to lute the crown with a prepared tooth. Like in building, the function of cement is to meet the two bricks with each other. But here, the function of cement is to lute the crown with a prepared tooth. Now we apply the dental cement on the prepared tooth, and we apply the dental cement on the inner portion of the crown, and then we place this crown on the prepared tooth, and the cement will be set, and this cement meet the crown with the prepared tooth or lute the crown. Therefore, cementation, also known as luting. Cementation or luting of indirect restoration. Now, which cement we use for cementation? GIC, glass ionomer cement, and second is resin cement. Today, now in the recent condition, the most widely used is resin cement. Now come to the second use. The second use of the cement is cavity basis. As a cavity basis. What is cavity basis? When we prepare the cavity and when we restore the tooth of patient by metallic restoration, like gold crown, like metal alloy crown, then the main property of the metal is they conduct the heat, and when we take a tea or other heat object, the heat will pass from this metal and reach to the pulp, which is the vital structure of tooth, which have blood vessels, nerves, and due to nerve sensitivity, due to when this when this heat reach to the pulp, we feel pain. Now, to prevent the thermal conduction of metallic restoration, we give a base, cavity base. We use cement as a base below the metallic restoration. This is metallic restoration. Below the metallic restoration, we give a cement base, which to protect the pulp from thermal shock of metallic restoration. This is the second use. Now, which cement we use as a cavity basis? Modified zinc oxide eugenol and glass ionomer cement. This is the second use of dental cement. Now come to the third use. We use dental cement as a cavity liner. Now, what is cavity liner? Same like cavity basis, we use the cement below the restorative material to prevent the pulp against chemical leaching from restorative material. When chemical leaching from restorative material and move toward the pulp, to prevent the pulp from leaching of restorative material, we give a cavity liner. Now, cavity liner is same like base, but its thickness it is thin than base, and the cavity liner is different. The cavity base function is to protect the pulp from thermal shock, but cavity liner to protect pulp against chemical leaching from restorative material. Now this is the restorative material and this is the cavity liner. The cavity liner thickness is less than base and also have different function. Now which cement we use as a cavity liner? Calcium hydroxide cement and zinc oxide eugenol cement. Now come to the fourth use. The fourth use is we use the dental cement as an interim filling material. What is interim filling material? Interim means temporary, as a temporary filling material. Like patient come in ward, we plan to restore the tooth of patient by composite, by amalgam, but when we prepare the cavity for short time, for 10 days, 15 days, 5 to 6 days, we give as a temporary restoration. Then again when patient is come, we remove the temporary restoration and give a permanent restoration. Same procedure we do in a root canal treatment. In different visit we give a temporary filling material and then we replace this temporary material with a permanent restorative material. Now interim, number 4 use is as an interim filling material, mean as a temporary filling material. Now which cement is used as a interim filling material? Zinc oxide eugenol cement. Now come to the fifth use. Fifth use is aesthetic restoration. We use dental cement as an aesthetic restoration. Aesthetic restoration means which look like natural color. Which look like natural color of natural tooth. Which color is look like natural tooth color, which is aesthetically pleasing. Now which cement we use as a aesthetic restoration? Like glass ionomer cement, resin modified GIC. Now we use glass ionomer cement in anterior teeth as a aesthetic restoration. Now come to the sixth use. Number 6 use is root canal filler. We use dental cement as a root canal filler. Now what is the function of root canal filler? This is root canal and we fill the root canal with a filling material. Between filling material and root canal wall there is a space. We can seal this space by dental cement. This process is known as when we use dental cement to seal this space, then the cement is called as a root canal sealer. Now the 6th use is root canal sealer, which seal the space between restorative material and root canal wall. Now as a root canal sealer, now which cement we use as a root canal sealer? Zinc oxide eugenol and glass ionomer cement. This is the definition and uses of dental cement. Now today our topic is complete. We studied the definition of cement and uses of dental cement in detail. In next video we will study classification of dental cement, and in further video we will study each cement definition, indication, contraindication, advantages, disadvantages, properties in detail. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon to open all notification in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.